Have you ever wondered if tuberculosis can affect more than just your lungs, perhaps your bones or your kidneys? Doctors use a variety of specialized tests to diagnose extrapulmonary tuberculosis, which is tuberculosis outside of the lungs. The approach depends on which part of your body might be affected, making diagnosis a careful detective process. Extrapulmonary tuberculosis is tricky because it doesn't always show up on a standard chest X-ray or sputum test. The Mycobacterium tuberculosis bacteria can travel through the bloodstream or lymphatic system and infect almost any organ. This means doctors need to target their diagnostic efforts to the specific site where the infection is suspected, as each body part presents unique challenges for sample collection and analysis. For example, tuberculosis in the spine requires different methods than tuberculosis in the brain or skin. To find out if you have extrapulmonary tuberculosis, doctors will start with a thorough medical history and a physical examination. They will then identify the affected body part and collect tissue or fluid samples from that specific area. For instance, if tuberculosis is suspected in your lymph nodes, a biopsy of the swollen node might be performed. If it is thought to be in your joints or bones, fluid could be extracted or a bone biopsy taken. In cases of tuberculosis affecting the brain or spinal cord, a lumbar puncture might be done to collect cerebrospinal fluid. Sometimes, special scans like a CT scan, which is computed tomography, or an MRI, which is magnetic resonance imaging, are used to pinpoint the exact location for sampling or to assess the extent of the disease. Once samples are collected, they are sent to a laboratory for specific tests. The most common and crucial test is a culture, where the sample is grown to see if Mycobacterium tuberculosis bacteria are present. This process can take several weeks, but it is considered the gold standard because it confirms the presence of active bacteria and can also be used to test for drug resistance. Another important test is a nucleic acid amplification test, or NAAT, which can rapidly detect the genetic material of the tuberculosis bacteria. There are also histological examinations, where a pathologist examines tissue samples under a microscope for characteristic signs of tuberculosis infection. These advanced techniques help overcome the diagnostic challenges of extrapulmonary tuberculosis. So, while diagnosing extrapulmonary tuberculosis requires a bit more investigative work than pulmonary tuberculosis, the combination of targeted sample collection and sophisticated laboratory analyses allows doctors to accurately identify the infection. Early and accurate diagnosis is key to starting the correct treatment promptly, leading to better health outcomes and preventing further complications.